today's presentation is talking about simulated practice learning, so bridging the gap using OMS. Your hosts for today are myself. I'm Dawn-Marie Dunbar. I'm the clinical product manager here at OMS. I'm a nurse. I've been a nurse for about 100 years and been in education for over 20, and here with OMS for about 3 years. The star of our presentation today is my colleague, Amy Wilkinson, and I'll let her introduce herself.
Hi, everybody. I recognise lots of names on the chat, so that's quite comforting. This is my first time doing a webinar, but I am, as Dawn-Marie said, I'm Amy. I'm the Clinical Account and Impact Manager here at OMS. I've been with OMS about 2 years now. I think it's the end of this month is my 2-year anniversary. I am a paediatric nurse by background, and I also worked in a university in the Northwest where we utilised OMS as part of our simulated placement, hence why I know a little bit, if you like, and also I'm the one that goes out on site and does a lot of the implementation and support with the guys over here in the UK. So yes, that's me.
So our objectives and agenda for today are to understand the NMC guidance on simulated practice learning, to review research and evidence supporting simulated practice learning, explore how Oxford Medical Simulation supports SPL, examine some implementation models and some case examples, and identify practical next steps.
So we're also going to bring into that, Dawn-Marie, just with regards to the feedback as well. So the elements of why objective feedback is so important and the reporting and the benchmarking, we'll look a little bit more further in that in later in the slides as well. Okay, so why does SPL matter? So essentially, obviously the NMC, the crux of the bottom here is the NMC formally recognises that we can use simulated practice learning for up to 600 hours. How we do that, everybody interprets slightly different, and obviously there's lots and lots of guidance on this for us in the UK, if we're looking at it from the UK lens, if you like. But essentially, we know that the pressures of placement areas is really intense at the moment. There aren't enough placement areas for our students to go out to. We're ever increasing our numbers. I know so many universities who have doubled their numbers in the last couple of years, and that there just simply isn't the placement resources for that. So that's part and parcel of why SPL can be a really, really good resource for our universities to be able to use. We're really wanting, obviously, to make sure that we have safe and consistent and high quality practice areas for our students to learn and develop their experiences and clinical competencies in. And part and parcel of SPL is we can really standardize this for our students. We know ourselves that we have some students that go out and get one experience, and then student number 2 gets a different experience. So part of SPL is that we can really standardize this as well. Sorry, go on, Dawn-Marie.
Sorry, I was just going to ask you, are there any particular clinical placements that are sort of universally challenging to secure across the UK?
Yeah, so we have quite a lot of challenging areas. Some of those are kind of cross fields. So within our nursing structures and within our training, student nurses have got to get exposure to all of different fields and different kind of across the lifespan. So for example, an adult nurse getting exposure to mental health areas, specific areas, or child fields. Now that's where we really struggle, is to get a lot of our students all of those exposures. So obviously with the use of tools like OMS, you can really fill those gaps that students are missing out on, if you like, or might not have the opportunity to experience when they're out in clinical placement. Okay, fabulous. So what is SPL? Obviously, everybody joining the webinar today has probably got some element of exposure or experience of what simulated practice learning is. But the NMC, you've got the definition here, and it's basically structured supervised learning experiences that replicates real life environments to help students meet program proficiencies. Now, the way that the NMC kind of structure this isn't this is how you do it correctly. And that's obviously because everybody does it a little bit differently, and some people have got different experiences experiences to bring to the table. You can use SPL from up to 600 hours. Obviously, there was some COVID guidance and things, and there was some COVID standards, but we're not in that anymore. But we can still use the 600 hours if you're signed off by the NMC and have that properly integrated into your program. It has to have learning outcomes. So it can't just be that, we're going to put on a week's placement and hope for the best. The structure of the placement has to be that they have some real learning outcomes, and that the students are going to be supervised, assessed, and quality assured as well. And that's one of the really key things here. It's to do with that CHSE guidance that we have in the UK, and making sure that our simulated practice learning adheres to all of that. So requirements for the SPL. So we've got a lovely kind of table. So it's to do with authenticity, supervision, quality, equity, and also reflection. So as with any clinical placement, the students require it to be as real as possible. And it needs to reflect the real world practice, which is what you're trying to achieve when you are putting together an SPL or simulated practice learning, or hours that you're going to attribute to your simulated practice. Students have to be supported and assessed. So that's to do with, again, that CHSE that I mentioned before. So that is all about making sure that the students are supervised and assessed in an appropriate manner. Now, that appropriate manner, again, can sometimes be a little bit open to interpretation. Some universities use it as touch points. So they'll have some sessions in the morning, and then they'll have some supervision, some clinical supervision throughout the day if you're doing a remote session. Others take it very literally that the students need to be in the building. So that, again, is open for a little bit of debate or discussion, if you like, about how we do that correctly, efficiently, and making sure that it's useful to the students as well. It has to have learning outcomes that we've already discussed, and make sure that it's quality assured. It has to be accessible, so you can't have a placement that's not accessible to all of your students and your different learning types as well. And then obviously you're thinking about the reflection. So students, student nurses, and all healthcare professionals. I was actually with physio students this morning, but it's all about that becoming a reflective practitioner. And part and parcel of simulation is that we have structured debrief and reflection as well. And again, with regards to OMS and linking it back, we have that built into the platform, which we're going to touch on a little bit further down the line. But Dawn Marie, how do you think this might meet some of OMS can support meeting some of these requirements?
Well, I think that when we're looking at what are the different areas that you need to check off as you're going through simulated practice learning, being able to apply different competencies to the scenarios, and being able to look at that feedback and directly link them to being able to sign off on those competencies is particularly powerful. And I know we're going to talk about that a little bit later. In addition to that, I think that one of the things that can be very powerful is being able to work with a group and actually see how a group is dealing with a certain particular set of patients, and especially in those areas where you discussed that it's a challenge, whether that's pediatrics or midwifery, trying to look at how do we support them in their learning when they don't have a lot of opportunities to make decisions with those types of patients. So I think as we go on, we'll be able to see some really specific examples of how that might, how I know OMS can address those.
Fab. So I'm not going to kind of read off the slide here, and we're all, you've joined this webinar because you've got some exposure or experience within the SPL space, or, wanting to learn a little bit more. But essentially what we're trying with this slide, it's just showing that simulation improves students' practice, and there's lots of research to show that. The NMC have done really large evaluations. They've done deep dives into the different programs. They did a big study that when they released their document earlier this year, I think it was, where they looked at 19 different universities and so on. So there's lots and lots of evidence here, research and evidence on this slide. And I think one of the questions has been, will we share the slides? And they will be shared after the session, so you'll be able to kind of dive into these and have a little look through and see any of these that might really resonate with what you guys are trying to achieve, or if you need to put a business case together, for example, or really go to your dean or your director and be like, we really need to introduce this, or we need to improve our offering of SPL, and then there's some resources here for you to be able to dive into and go through with them as well.
Mhm. Amy, these are all formal studies in, peer-reviewed journals, which are helpful when you're building a case. But do you have any specific feedback from faculty that you've worked with who are using OMS on how it supports their SPL efforts?
Yeah, so absolutely. I've got anecdotal feedback, if you like. So when I in the university that I previously worked in, we used to do pre-simulation surveys and post-simulation surveys. So we were really able to see the students' confidence levels, what their kind of preparedness for practice was, how we phrased it, and how the SPL, the journey throughout the couple of weeks where they were with us with the SPL team, that actually they improved their confidence. And it's not, we haven't written it up or anything, and there's no, so it is anecdotal, but essentially we've had lots of feedback from faculty members as well, where someone's come into the simulated practice placement area, really not having that confidence level, and come out the other end of a week or 2 weeks, however long has been scheduled. And then they've said, you know what, I feel ready for practice now. So it's really building their confidence. And I feel like with simulated practice, that's what we want to do. We want to make sure that our students are going out with, with the tools and preparation that they require to face the real world. And, we're rebranding, if you like. And one of that is, being real world ready, and making sure that our students are ready to take on the placements, and, making sure they're prepared for practice. So it's not written up as such, but it is my personal experience and also feedback from universities that I'm working with at the moment.
Yeah, I know one of the things I always used to encounter is learners would say to me, I know what the content is of what I want to say to a patient. I just don't know which words to choose, to say it, so I don't offend someone, or make sure that they can't see that I'm nervous. So I think even just the small communication piece of being able to prepare learners before they actually deal with patients is worth its weight in gold. And then you add all the stuff as around, clinical decision making and the feedback and so forth. So I'm excited to see, how we're going to tie all these pieces together.
So why virtual reality? So obviously we are a virtual reality program, whether that be using headsets or on screen. Obviously you've got the mixed modality there with regards to specifically with OMS. But what it provides the students is they're able to repeat and practice in a safe environment. One of my kind of icebreaker phrases to my students when I'm doing onboarding sessions or getting students ready for their sessions is, you can't kill an avatar. So they're really able to practice and rehearse as many times as they want. I was doing a session this morning with some physio students, and someone turned around and went, "Can I do it again?" And I was like, absolutely, take on board that feedback. They're able to reflect on their attempts, and then, really improve that as well. We're also able to give them access to stuff that they might not see in practice. So we all need to be world ready for our anaphylaxis patient or a seizure that we might not have seen before. And we're able to give them access to that via, virtual reality and these simulations that we provide via OMS, because it's, rare and complex conditions they might not see, or sometimes a student might a little bit be on the back burner. I still very vividly remember being a student, and I had a seizing patient, and I was just kind of on the side. They were like, "Can you go and get this? Can you do that?" And then I think you work your way up, and sometimes you become a scribe. But until you're really the person who's driving those clinical decisions or kind of looking after that patient yourself as a qualified member of staff, sometimes it can be a little bit scary as well. So the students can really be active in their learning. The other thing is it's experimental, so that they can go in and see cause and effect. They can see, okay, well, what does this do if I do that? Or I don't put oxygen on this patient, or okay, well, I do. And they can really see that and learn via experimenting. And sometimes we learn best when we do the wrong things, because we see something, we see the negative impact that something has. An example again of that is I had a patient give one of our patients, give one of our patients on the VR penicillin when they had a penicillin allergy. And they didn't admit this at the time. It was afterwards. They were like, "I just wanted to see what happened." Obviously, in real life, you're not going to do that, but this is giving them the safe. And then they had that feedback. You administered an incorrect drug that was detrimental to your patient. So they're really getting that immediate feedback as well. With regards to OMS, obviously, they get the immediate objective feedback. So everything that they do or don't do within a scenario is fed back to them via their feedback points at the end. And it really bridges that gap. I think we have a big divide between our theory and our practice. And this is one of the resources that can be really utilized and leveraged for our students to bridge that gap and to go from, okay, well, this is what you've learned about asthma in your classroom. Now go and look after an asthmatic patient, but in a virtual world, so that it prepares you for that real world asthmatic patient that you're going to come across.
Yeah, Amy, I think one of the most powerful things on this slide is that objective feedback piece. And I know we're going to talk about it more later, but being able to take that feedback and link it to specific outcomes, especially when we're reporting or we're recording, what learners are doing is really important. And of course, we've all experienced, most likely with learners, they'll look for any opportunity to say that they didn't perform well because someone else didn't like them, was tired, didn't have time to work with them, was distracted. And in this way, because OMS doesn't require a facilitator who is human and does have all of those human challenges, it's very objective, that data that you're looking at. And we'll talk a little bit more about it later, but I think it's really powerful. So let's talk a little bit about what OMS and what we can do. And many of you are familiar already because you're our customers. But we're always striving to make sure that we deliver the most immersive, data-driven learning through both virtual reality and on-screen platforms. And I think one of the things that Amy said earlier is the flexibility of being able to either be in the headset or use laptops, I think is one of those things that's really important, especially when we're looking at accessibility. And whether that is a physical accessibility, because some people can't tolerate being in a headset, around 4% of the population just can't tolerate it physically. But then when we also look at, economic reasons why you can't use headsets, and that laptops are more readily available and affordable in many cases, and being able to scale with laptops. So I think it's always important to think about the fact that we have that flexibility. We're always looking at how do we enhance realism. Our art team is actually in the middle of a very big project that will even, boost our game higher when it comes to realism. So we'll be excited to roll that out when it comes. Scaling and standardizing quality is really important. And then the reason we all come to work every single day is to improve patient safety. And that's we come back to that many times if we're struggling on making a decision, is how does this affect patient safety in the long run? We're helping organizations by delivering consistent evidence-based training. So our clinical authors are all clinicians who keep on top of the latest practice standards and have practiced themselves. So that's one of the things that I think is a strength for us. Amy talked earlier about building that confidence and competence up front before learners ever have the opportunity to be in a clinical setting. It's already really scary for them the first time they walk through those doors, and being able to give them some confidence before they do. And also as educators, being able to assess, are they actually really ready to be in that setting, and what can we do to set them up for success? And then most importantly, to reduce placement pressure and improve accessibility. Amy talked a bit about especially the challenging areas to be able to get learners to see, as well as, are there a core set of conditions that we know are really important for our learners to see before they actually are out there in professional practice. I know in my own simulation lab, we, like chest pain was a big thing. You could see chest pain no matter where you were practicing. And certainly, our learners were not getting to see that when they were out doing clinical rotations. And so that was one of the things that we wanted them to be able to do in the simulation lab. And being able to do that using VR was really helpful, because they always wanted to repeat the scenario And if we were doing it using it traditional methods, we didn't have the time and the resources for them to be able to complete it. So to repeat it. So that's been really helpful. So platform overview, we have here 240 clinical scenarios. In a couple of weeks, it'll be even more than that. We'll be pushing almost probably 270. So that's exciting across, a wide variety of practice settings. So emergency, pediatrics, mental health, midwifery, and, fundamentals as well. A lot of our fundamental and communication scenarios that we have are appropriate, not just for nursing students, but Amy's actually visiting a client today that has many physio students. And so looking at how are we able to use those same scenarios, but for different professions. We already talked about this. You can use the VR or on screen. And then our interactive features. So in a headset, you're able to use hand control to do things like procedures. On the laptop, you're able to use voice control. So to be able to have, an AI-driven conversation with a patient. So being able to have the learner actually use their own voice is really important. And then, of course, we have, teamwork models as well. So when you're practicing, interprofessional communication or teamwork, you have the opportunity to do that as well.
Okay, so one of these, this is a really simple but effective slide, I think, with regards to OMS, that you can prepare, perform, reflect, and improve. And it's really simple methodology, if you like. You're making sure the students are ready for the scenario. So we pre-brief them. Again, we have all these resources already built. I'm the builder of most of the kind of pre-brief guides, and myself, Dawn Marie, and some of the other team. So if there is a missing one, let us know. You'll have the briefing guide. You're able to perform the scenario. It's an immersive clinical scenario. The patients, they clinically adapt, they dynamically adapt, so to do with what the students do and don't do within the scenario. They then are prompted to reflect. So at the end of the scenario, they have a guided debrief, and that is just as important as the scenario. And it's one of my biggest bugbears when students just click straight through to get to their score, is that they're not taking in that guided debrief time. So it's really important that we really encourage the students to do that. They have the analytics as well that they're able to dive into and all of that feedback. And then they're going to improve when they look at their feedback and they take on board everything that they're saying. They can improve and then repeat that scenario. And I think that's really important. And I think, Dawn Marie, you're going to allude to that now.
Yeah. So the power of the repeat. There's really nothing else that we allow learners to do or have the opportunity to do again. And as Amy mentioned, and I have experienced this many times, a learner comes out of the headset, and before I can even say anything, they say, I know what I did wrong. Can I do it again? I can't think of anything in 20 plus years of education where a learner would ask me to do something again. Like pretty much they just want to do it and be done with it and move on. Once in a while an exam if they didn't do well, but in general, nothing else. And I try to encourage people as you're planning learning sessions, if you absolutely can, plan some repeat time in there. The amount of learning that can happen between doing a 20-minute scenario, taking 5 to 10 minutes to read their feedback, and then going back in and repeating the scenario, just seeing their score change is exciting for them and fun. And it's exciting and fun for us as educators as well. Or at least maybe being able to allow them to repeat it on their own time. Don't underestimate the power of the repeat. So feedback and analytics, we said we were going to come back to this. We often say at OMS, people start with us for the scenarios, but they stay with us for the feedback and analytics. And so, that performance-based scoring, Amy talked about it earlier, it's really based upon, did you do the actions? Did you or didn't you? But the more comprehensive layer is what was the timing of those actions? Did you do them in a timely fashion? What was the order that you did them? How did you prioritize them? All of those things are baked into sort of that scoring and feedback because, of course, we know There are certain things that we need to do in a very timely manner in order to protect the patient, as well as certain things need to be done in a certain order. But there are other things that are more negotiable, and we've reflected that in the way that we score. We have competency-focused feedback. So as you know, you can take those NMC standards and choose that as your competency framework and be able to put those to tag each piece of the feedback. So if you directly want to be able to show that in any reporting that you're doing. But I also think that's really powerful when we start looking at especially learners who are struggling. So looking at, is there a trend? Is there a certain standard or area that they seem to struggle in across the board? And it helps us as educators really sort of provide them the extra support that they need to be able to sort of get over that hump of what's that area where it's just not clicking in their head. So Amy alluded to the debriefing templates, and she's not lying. She does a lot of the heavy lifting there as far as getting those debriefing templates up and ready to go with new scenarios. A word to that, we tried to keep them really general. One of the things that we did run into, not necessarily in education, but a little bit more in healthcare with our healthcare clients, is there were educators who were administering simulation who had no simulation training. So they weren't debriefing because they didn't know how to debrief and didn't have time to go to a debriefing course. So we really wanted to provide just like a basic guide of how to debrief, because everyone deserves a debrief, right? So do know that those are really basic, that you can customize those in any way that you would like. They're not meant to replace an experienced debriefer because we all know those are gold. And but just know that they're there to help, especially novice or people who have no experience whatsoever. And then one of my favorite things is our institutional level dashboards. So we're able to look at, how is a particular student doing? How is a particular cohort doing? Looking at them over time. There's a million different ways that you can cut that information that's on that dashboard. And certainly if there's a way that you need to look at it and you don't see it there, please reach out to us, and there may be a way on the back end that we could pull that data in a way that is more helpful to you for whatever your particular project is.
Okay, so using OMS kind of in action, if you like. So what the premise of it is that learners will practice the scenario. They can do it anywhere. They don't have to be in the university building or in the hospital, wherever setting you are in. You're able to do this. They can do it at home. So they can load it onto their laptop. They're able to practice and rehearse the scenario as many times as they want. That feedback is gathered and their data is gathered automatically so they can see it. But also, as Dawn Marie just mentioned, from a faculty level, you can see it. And something I just wanted to bring up there, I know of a university that was using OMS as part and parcel of action plans. So if they had students who were specifically failing in a certain area or really struggling with a specific topic or element, then they could use OMS to really try and get them, okay, well, let's get this together. Let's try and work out what's going wrong. Let's work out where you're failing, where's the issues here. And they used OMS for that. So that was a really interesting use case. Educators can track the progress, and obviously they can support the reflective things the reflections that the students do as well. And it just shows that the institutions as a whole, they can demonstrate that they're using quality and consistency because they have that objective feedback. They have that automatic data. It's not one lecturer saying A and another lecturer saying B. You have the objective feedback that's stored in the system and in the program. So it's really,
and that feeds into scaling, right, Amy? Because we're looking at how do we provide that consistency across a group of learners. And many of you have really big groups of learners that you're trying to provide these learning opportunities to. And so the scaling piece becomes almost the linchpin in whether or not you can provide the best SPL possible. So.
Definitely. So we're going to talk about implementation models. So this is like how you actually could utilize OMS scenarios. These are the 4 that we're going to cover. We've got a slide on each, and we'll just talk around a little bit each of these 4. So we've got independent, faculty free, independent but with a faculty debrief, good group but faculty led, and then group but peer led. So we'll go through these now in a little bit more detail. So independent, faculty free, it is what it says on the tin. You set the learner a specific scenario or a number of scenarios to complete. They do this asynchronously. They can do it at home or in the building. I've had universities that do both, or one or the other, or a combination. So you can really set that how works for your structure and your setup at your institution. Obviously, it's scalable because it means that the students are able to access this at home. They can do it around what works for them. They may have kids they have to drop off at 9 o'clock or what have you. They can come home and do their learning as long as it's completed, in a timely fashion. If you've got set times with regards to your SPL, the students, it really builds their autonomy because they're able to do this themselves. They are in that clinical driving seat. They are the ones that are making the decisions for the patient. They are the ones that are practicing and rehearsing this. So they really are autonomous in that regard. And obviously it's building their reflective practices as well. And one of my things that I always say to people who are implementing SPL using OMS is ensure that the reflection is built, the time to reflect is built into their hours. So they may have a 20-minute scenario, but it's them building the time in to do their reflection and make sure that they do a really good reflection as well. We don't just want them to go, yeah, it was fine. We want them to really think about what that scenario, how it helped them, how has it impacted them, what did they do well and not so well, and so on. And it's really, really good for bridging that gap between, if there are gaps within placement. So say, for example, you can't get a child placement for some adult students, you might want to utilize some of the OMS scenarios to really give them that exposure to your child population and how they would care for a child. But also within our child scenarios, you have a carer or parent. So it's how you kind of make those decisions of who you address first, who do you talk to, how do you ask the child the right question, and so on. So it really does bridge that gap as well. Then we've got our faculty debrief model. So with regards to faculty debrief, the learners are all completing the scenarios kind of on their own. However, they're coming back and they're being debriefed together. So it might be that we're all in a computer suite and we're all doing our own scenarios, but then at 10 o'clock, we're going to down tools and we're all going to come together for that debrief. Or you do it remotely and say 9 till 10 scenario completion, 10 till 11, we're going to come online via Teams or Zoom or whatever your institution use, and we're going to have a debrief together with an educator, and they're going to lead that debrief. And that's where those guides come in, and you can really pick and choose some of those questions and some of those topics to chat with the students. And obviously everything links back to your learning outcomes. You're not going to debrief something that's completely random within a scenario. You're going to think, right, my learning outcomes were A, B, C, so my debrief is going to link back to those when I'm doing my debrief with my students. You've got obviously a combination there. The students are doing the scenarios themselves, but you've got that element of supervision as well. So if you want to take the literal sense of supervision, then you're coming back, you're having those touch points with your students and able to really bring it all back together. You also get really rich discussion from the students in this type of model, I think, because everyone does things slightly differently because of their own experience from previous placements or previous jobs or what have you. So it's really interesting and really discussion kind of focused around how people do things slightly different. Obviously, you've got your formative assessment in there. I just wanted to touch on that. I know this webinar is focusing on SPL, but obviously there is so much more that OMS can be used, and assessment is one of those things. So do reach out if you want to chat about that. And it enhances the reflective dialogue. I've alluded to that when I've been saying about how it really, really starts those discussions and students reflect on why did so-and-so do it slightly different to the way that I did it. Oh, well, actually, there might not be a completely right or wrong answer, but the way that they did it was because that's the way they've been taught. But let's look at the research. Let's find out what the evidence behind which way we should do it, or maybe there is right or wrong, and there is, okay, well, it doesn't really matter as long as you've got you've got an evidence base for why you performed an action in that manner.
So this is probably one of my favorite things. I actually wrestled Amy for this slide. Group learning models. I've used OMS very effectively with groups, and especially with novice learners because they're nervous. They have a limited knowledge base, and when you put them together, you multiply that knowledge base. So one of the things that I have found to be really helpful is most nurses in particular happen to be a little bit on the competitive side. I'm sure you've not come across that at any point, but I tend to find that they are, is putting them in teams and having them complete scenarios together. And be able to then come back as a team and be able to discuss how it went, what they should do better. And then you can bring them as a large group with all the teams together to do a debrief. But one fun thing that I have done with them is have them debrief as their own teams, and then go back in and repeat the scenario, and then see how much their scores by a percentage in each team improved, and then be able to bring everyone back together after that, that round of repeat had happened, to talk about not specifically the scenario, but what they learned between attempt 1 and attempt 2. I think this is a great way to model collaboration and professional communication. It promotes teamwork and shared decision-making, having them be able to discuss, what is it that we should do next? No, I think this is what we should do next. No, but that didn't work last time. Let's try it this way. And I also think that it builds psychological safety, knowing that you're in a group. It's not totally dependent on your performance alone. Although as a learner becomes more confident, they want to do them by themselves. They want to be able to test themselves. But at the beginning, it really helps with that psychological safety.
So how does OMS align with the NMC standards? Now, we probably should have mentioned this at the beginning, actually. Back in March, we ran a roundtable where we had a section that was on SPL, and this is kind of a little bit of a continuation from that. And we were really lucky to have Paula from the NMC there as well. So the reasons that OMS can align to, or does align, to the NMC standards is it meets the requirements for your supervised and assessed authentic simulated practice learning. So as long as you are implementing it in the correct manner, you are able to assess your students, you are able to supervise your students effectively. And obviously with the clinical authors being all clinicians, it is authentic. So it is, as true to real life as we can get the scenarios. It really supports that reflection and feedback. So students are guided through that reflection. They are prompted at the end of their scenario. They can't get out of it. They are shown how they are able to do that reflection. And they also have a part of their feedback form where they're able to document that reflection as well. And a lot of universities are utilizing that and leveraging the platform as a whole to make sure that they're having the evidence of the hours for the SPL if they were to be inspected or anything like that. It enables accessible and equitable learning. So every student is getting the same scenario. Everything is quality assured from our point of view, and the students are accessing this themselves. They're not having those different placement experience that we mentioned earlier. They're not having a day where they're just sat waiting for a patient to come in if they're in a really a remote clinic area or something. They're all getting the same experience, and it's equitable across all of our learners. And that is really, really important, and obviously aligns with our NMC standards. So
the bigger picture, SPL and OMS are made for each other. They work well together. Safe, you can plan it out. It's predictable what your learners are going to experience and what those learning objectives are. The confidence and competence, we talked about this, especially before patient contact. And then those data-driven insights for continuous improvement. Those are all the pieces that you need to be able to talk about when you're looking at your SPL experiences.
So implementation, like considerations. So thinking about how it transitions from, okay, we have OMS, how do we really get this implemented and effectively and also sustainably as well? Obviously, we're needing to get faculty buy-in, making sure they have the correct training, making sure that they're au fait with the platform really helps that. If you say to somebody, oh, here you go, here's a resource, that's not going to enable them to go and use it effectively. We really make sure that the faculty are trained to a high quality and that they're feeling confident in the platform. Part and parcel of my job and the other guys in my role are we do curriculum mapping. So you send us a document or modules or learning outcomes, however you structure it, and we look at what scenarios really match across to your curriculum and to your specific set of learning outcomes. Obviously, technical support and setup. So thinking about what tech have you got? Have you got the right computers? All of those things. Have students got access to computers? Like I said, the session we did this morning was in an IT lab. So it was great because OMS was on these devices. They were able to jump on. And then the students also brought their own laptops to get that downloaded so that they're able to utilize OMS at home as well. How students are prepared is a really key thing here at the success of utilising OMS within SPL. I've seen it done poorly and I've seen it done well. So we can really give you some kind of tips and support that as well. So correct student onboarding, making sure that they know how to utilise the scenarios, how to use how to leverage the feedback and things to then repeat all of the elements of a student journey from getting access to the platform right the way through to using our reflective tools and using our feedback effectively is really important. And again, we support with that as well. And then evaluation and sustainability. We can have all of these great tools, but if we don't evaluate them, we're not going to come to a point where yes, they're useful, or yes, they made they made use of the resources they have. So we need to be able to evaluate that, and that comes with data evaluation from students. I kind of saw some chatter in the Q&A earlier about have we seen evaluation or have we got evaluation tools. I think Jess shared a really good document with people. So thinking about that is really important. One of the things, and I think this sustainability is important from a user friendliness and ability to use it sustainably throughout a program or a degree. However, also thinking about obviously the sustainability of OMS. Your resources, it's never ending. It's not like you're going to run out of syringes or you're going to run out of blood bottles. It's a never ending resource. You can go in and repeat and do scenarios as many times as you want. So I think that word can be probably used a little bit interchangeably there with what we mean. So yeah. So how kind of the get down to brass tacks, how you create a simulated practice learning placement. So what you're wanting to do is you're wanting to start at the top here. So you can see we've got a nice little circle, and this is ever evolving as well. It doesn't, just because you've created it for 1 year doesn't mean that we're not going to evaluate it and create it or change it again for the next year. I was part of the team that created our SPL for the university I worked for. And essentially we were changing it every single time. Every iteration we changed, we made a change. We made sure that we took the students' feedback on board. We introduced new technologies. We did this, we did that. So it's ever evolving. So we're going to start with our learning outcomes. And obviously with any session that we have or any teaching session, we're going to start there and making sure that they're mapped to the NMC proficiencies, thinking about what skills do you want to do, what behaviors are you focusing on, what does SPL fill, is there gaps within your program that you need to fill, is there areas that the students are identifying that they're not they're not getting exposure to. Think of along those lines. Then going to think about simulation type. So are you going to use your headsets? Are you going to use laptops? Are you going to use a mixture of both? That kind of is really important. Deciding on scenarios, that's where we can really step in and help you think about what scenarios you're wanting to use within your simulated placement. Whether that is a group of scenarios, one, and then we have some alternative activities afterwards. It really depends on what your learning outcomes are. You're then going to debrief and plan your facilitation. So plan your facilitation and debrief. So make sure that you have all of this really sort of down on paper. Make sure that you know exactly how the day is going to run or the sessions are going to run and so on. So that's really important. Then we're going to move on to alignment with any assessment and feedback, and then think about piloting and reviewing and refining. So like I say, it's just a constant cycle that we make sure that we keep going around and refining as we go through.
Yeah, and those line up with best standards of practice for simulation. So, and nursing process, if you think about it.
So the bigger picture, we've kind of got a few challenges and just a few mitigations, if you like. So obviously, faculty time is a massive challenge at the moment within the whole of the education space, the NHS, but everywhere really. So thinking about different models, and you can use this, you can leverage OMS to really use independent learning types. So students can go off and do this themselves. They can practice and rehearse as many times as they want. Access, obviously students are able to use on-screen or a headset depending on what route you're going down. I'm seeing more and more students that have headsets or have access to one as well at home, so you can obviously utilize different learning, different access there. QA consistency, obviously we have our analytics dashboard, so students are getting the exact same feedback whether they attempted it, on Monday or on Friday. They're getting that same feedback. And then student engagement, we know it's a problem. I was part of, I've been part of university. I know it's a problem. So it's really important that we try and engage our students with different methodologies. And one of these is the fact that we're gamifying scenarios. We're making it fun for our learners. And then obviously they get that feedback instantly, which is what students want. They want to know how well they did. They want to know how they can improve. So it's really important that we've got all of these we've got mitigations for these challenges.
Yeah, so Amy, I think one of the things that's interesting, and I just was exposed to this in the past week here in the U.S., and that is looking at e-gaming. So looking at, we're seeing this in, middle schools and high schools and even in university now, where gaming is actually considered something really serious, and it's looked at like any other sort of sport. And so we're seeing that our learners that are coming to university actually already have a lot of experience with working with this kind of learning. And if you think about it, a game, you're learning, right? You play and you want to get to the next level, and you play the first level and you learn what it is you need to get to the second level. And certainly these gaming communities and teams that we're seeing our learners come with, they learn skills like teamwork and leadership. So we're going to see this where our learners are more and more engaged with this type of learning, and in fact are probably going to expect it. So, back in our day, our parents were always saying, no, you can't spend that much time on the video game. Don't do it. But now we're starting to see more and more that gaming is a really important way to engage and have learners be able to improve themselves and not just in their score. So pretty exciting.
So to sum up, I'm conscious of time, we will leave some time for question and answer at the end as well. So SPL is recognised as an evidence-based practice learning. So it is recognised by the NMC, and we're able to utilise that. And that is one of the really important things here, that as long as you do it correctly, then it is a recognised practice learning hours, and you're able to claim hours for it. It enables scalable. So you've got that element where you can scale your authentic learning, and you can measure as well. You've got your outcomes, and you've got all of your objective feedback there. So you're able to review that. And using VR and using this methodology it really enhances realism. It's accessible, and hopefully it has an impact on your learners and your students with whichever method that they use, VR headsets or on screen. It really does have that impact. So it it's a really great tool to leverage for your learners in a format of SPL. So we want kind of like you to have a little think about 2 takeaway questions, if you like, and it might be that you go away and have a chat with your colleagues about these, but how could SPL and OMS be integrated into your program to enhance student learning? One of the key things that we want to make sure is that we have, good NUS scores as a big, in the UK, it's our national kind of measure of student engagement and how they've enjoyed their university experience. So thinking about that and making sure that we have lots of different technologies, but utilized correctly as well. And then also, what barriers or opportunities do you see for SPL in your setting? You might turn around and go, well, I just don't have the time, or I don't have this. And we're here to really provide you with answers to those barriers, if you like, and make sure that we can help you with the resources, help you with different methods, and think about different ways to do to be able to incorporate SPL into your programs.
Amy, I'm looking in the chat, and the biggest question I see is, will this presentation and the slides be available afterwards? And Kat from our amazing marketing team has responded that we will be sending this out. It takes a little while for the recording to process, but once the recording has been processed, we will send this out to everyone who attended the webinar, as well as make it available for those that haven't. Feel free to share the recording with others. We appreciate that when you do that. Those are really the biggest questions. I see that someone was talking about AR and XR and how they want to be able to use that with their students. Currently we aren't using any AR technology, but that is something in the pipeline that we're always looking at. One of the things that I used to do with my students was have them do a VR scenario, for example, for pediatrics, because we here in the US also struggle with those sort of placements. We would have our students do a couple of the pediatric VR scenarios, and those were sort of their ticket to ride when they came in for their in-person simulation day. And from the feedback that they got from their VR scenarios, they actually had to come in with a list of 5 things that they wanted to improve during their day of in-person simulation. And it totally transformed the learning that happened during that day. Number one, the students were more engaged, they felt more prepared to be there, and they actually got to work on things that were concerning them about their own performance. So that's one of the ways that we have used it. So are there any scenarios that could be used for CNAs or PCTs? Amy, you want to talk about that?
So CNAs and PCTs can mean different things. So is this a US or a UK question? If you're meaning clinical, I don't know if we have
the nursing assistants.
Yeah, I think we have this. We have HCAs and so on. So we absolutely have a number of different scenarios. We actually created some in the UK with our our assistant nurses with some of our hospitals. So we have got a little library, if you like, where that definitely would work for your learners, and there are a number of different scenarios that we can really dive into the fundamentals and thinking about your nursing care, just those basics, kind of entering a healthcare environment and so on is, we have got those scenarios. And we've also got some basic communication scenarios as well. So the students learning how to talk to somebody can be a big barrier for some of our learners, and the anxiety provoking. So definitely, yes, have got some scenarios that would definitely work for them. And I think we're going to have a slide at the end where if people want to get in touch, then we will be able to do that, and we'll get in touch with you, or a call to action. There we go, where you're able to get in touch with our team as well to be able to discuss that further. I think that's everything. I'm going to just finish with the simulation doesn't replace practice. It prepares students to practice safely, confidently, and competently. When I first became an academic member of staff, I was always a little bit worried that some of these technologies might replace me. But I think we all know, and we're all aware, that we're not going to be replaceable. This is just going to go along to enhance our student learning and to really prepare them to become safe practitioners. And that's what we want at the end of the day. We want to have people who are going to look after our family members, and that they are prepared and they are safe to do so. And that's part and parcel of what OMS and VR and all different types of methodologies of utilizing our software can do, and it's just prepare our students and make them safe practitioners.
So we have a question around communication scenarios being responsive to nonverbal elements such as pace, tone, and etc. So there are some subtleties in how long a pause is between, when you talk and when you respond. As far as the pace and the tone, right now using AI, it's really hard for the AI to be able to pick up tone and pace. But we're watching that technology, and as it gets better, we will build and improve our communication scenarios to pick up those. AI will pick up word choices. And so that's really helpful. as far as being able to sort of score those sort of things, as technology gets better, we'll be able to do that. As far as addressing the cost, I would have you use the QR code so that you're able to speak to one of our educational specialists, as they'll be able to ask you some questions and get your specific use case, because costs can vary depending on how many students you have, how many scenarios. They really can build a custom package for you. So I would encourage you to go ahead and use the QR scanner and put your information in. So we're going to wrap up. Your time is precious. We know that every second of your day is spoken for, and we really appreciate the fact that you took some time to spend with us today. And I hope sharing Amy's expertise on SPL has been helpful to you. So take care, everyone, and don't hesitate to reach out with any questions.
Thank you very much, everybody. It's great to present to you all.